Hello, I'm going to be teaching you how to do your wound care today. We're going to be going through that skill. The first thing you're going to do is go in, do your hand hygiene, introduce yourself to your patient, and check your patient identifiers and explain the procedure to your patient. So I'm going to walk in the room, do my hand hygiene as I'm asking the patient his name and date of birth. Hello, my name is Dixie Holden, and I'm going to be doing your wound care today. I'm going to change this dressing on your leg and repack it with some clean dressing. Can you please tell me your name and date of birth? Mr. Bennett, 115XX. Thank you. I'm going to uncover your wound. First thing I'm going to do is put something under this leg to catch any irrigant that might drip. Mr. Bennett, I'm going to raise your leg up. I want this leg slightly tilted downward so irrigant runs off the leg. Okay. Now I'm going to tell you what is in this kit that I brought in the room with me. So the first thing I'm going to do is cover his bedside table so that we don't get anything from the bedside table on the equipment that I'm going to be working with. All right. In my kit, I have gauze, a roll of gauze. I have 2 pairs of sterile gloves. I have a 4x4 pack of gauze, an ABD pad. This is a single 4x4 gauze. I have a syringe and an IV catheter, and I'm going to tell you what I'm going to do with that in just a minute. I have a roll of tape. I have some saline irrigant. I have a pair of bandage scissors. I have a sterile dressing change tray, and I'll tell you what all is in that. I have a wound culture in case the doctor ordered that. And I have 2 cotton-tipped applicators and a measuring guide. And before we get started, I'm going to tell you a little bit about the syringe and the catheter. So this is a 10 cc syringe. You actually, if you were going to use this for the dressing to do the irrigant, you would want a little bit bigger than a 10 cc. This is the largest one I happen to have today, but you would actually want it to be about a 20 cc syringe. So I also have, let me take this out, throw this away, the IV catheter. And what you would do if you're going to use a syringe like this, in order to get pressure behind the irrigant, you would want to take the catheter, remove the cap, and you're only going to use the plastic part of the catheter. You're not going to use the metal needle. So I'm going to get rid of that. I'm going to take the catheter off, and I'm going to activate the safety device on the needle and put that to the side. Then if I were going to use this syringe, I would just attach the IV catheter. Then I would draw up my saline in the syringe and use this to irrigate the patient's wound. But this is not what I'm going to use today for this dressing. I'm going to set it to the side. All right, so I'm going to explain some of the stuff on the table first before we get started. I have this dressing change tray. These will all be a little bit different. So anytime you get supplies in a kit like this, sometimes you'll have something different in your kit. So this one happens to have a towel or a drape, a roll of medical tape, 4 gauze sponges, a safety pin, transfer forceps, a bag with a twist tie, an ABD pad like this, a pair of blunt tip scissors, and forceps, and 3 iodine sticks. So I'm going to go ahead and open this up in case I'm going to use any of this, just to show you real quick. It's going to come just like this, and I'm going to use the inside of this container for the sterile field that I'm going to be working with when I get ready to do that dressing change. But I'm just going to close that up real quick and set that to the side. Also, before I get started, I'm going to grab my container and pour my saline in it. So the first thing you're going to do is take your saline, and you're going to hold your hand over that label so that you don't ruin the label. You're going to check the expiration date, and this one expires in 2022, so I'm good. I'm going to hold my hand over the label, open the cap, and right now I'm just getting everything kind of set up. I'm going to set the cap right side up. I'm going to remove this. and holding your container over the trash can or something, you're just going to pour out a drop or two into the trash can. I'm going to remove this and pour it right into my container. Now this syringe and container would have came out of a sterile package, so the inside of that would have been sterile to do this dressing change. Then I'm going to get rid of my container and my lid. All right, now I'm about ready to get started. The first thing I'm going to do is do my hand hygiene, put my gloves on, and remove this dressing. Before that happens, though, I'm going to need my PPE on. So I'm going to go get my PPE, and I'll be right back. Okay, so I put my PPE on, and I also have a biohazard bag here to collect my my old dressing. So I'm going to take my scissors, my bandage scissors. They have a blunt tip, and I'm going to take the old dressing off. I'm going to check the last time the dressing was changed, and I'm just going to carefully, without cutting my patient, cut this old bandage off. And I'm going to put that in my biohazard bag. And while I'm taking this off, I want to note any drainage that I see on this old dressing, the size, the quantity, and a description of it. So what it looks like, what color it is, if there's any smells. So I note right away that when I take this off, I have some bloody drainage on there, but it's just a scant amount of bloody drainage. So I'm going to toss that. When I take this one off, same thing. I don't see any purulent drainage or anything, and I don't smell anything. Okay. Now I'm going to change my gloves. I'm going to perform hand hygiene. I'm going to put on another pair of clean gloves. And I'm going to irrigate the wound, and I'm going to measure it. So I'm not going to be doing the packing of the wound yet, but I am going to pack this just to show you. Keep my gloves on very well because they're wet from this hand sanitizer, but get them on here as best we can. Okay. All right. First thing I'm going to do is take my equipment that I'm going to be using for the measurement of the wound and the irrigating of the wound. I'm going to take this first 4x4 that I have here, and I'm just going to use it to catch some of the drainage. You want to make sure that you don't touch the actual wound itself when you're doing that, or touch over a place that you already touched. So I'm going to draw up some irrigant. I'm going to go from the top to the bottom and from the inside to the outside. So with this, I'm going to start here, and I'm just going to flush from the top to the bottom with some force. I haven't touched the wound itself with my syringe, so I'm going to draw some more up, and I'm going to irrigate the little wound below that, top to bottom, inside to outside. I'm going to pat this dry around here, fold it at the other side, throw that in my trash. And then I'm going to grab my Q-tip because I want to see if there's any tunneling or anything in this wound. So I'm going to take my Q-tip, and I'm going to measure all of the areas inside this wound to see if there's any tunneling. And so far in this one, I don't feel any. Okay. Check this one. Oh, sorry, my Q-tip broke. I don't feel anything in there either. So, okay, after you've measured for any tunneling or anything, then you want to measure the depth of the wound. So I'm going to hold the Q-tip in the deepest part of the wound, which I think is about right there. And I'm going to mark it just with my thumb. which I think is about right there. You don't want to touch the wound with your thumb. And then you want to hold this against the measuring guide and see how much it is. So it looks like about 1 centimeter of depth. And then I want to get a new Q-tip and measure the depth of this one. So I think that's about the deepest point right there. Do the same thing. I'm going to mark it with my thumb. And this one's about 0.5 centimeter. Okay. Now I'm going to measure the length and the width. This looks about 10 centimeters. And the widest part here is about 2 centimeters. This one is about 1.5 centimeters by 1.75 centimeters. And I'm going to toss that in the trash. Okay, now I'm done with the dirty part of the dressing. So I'm going to take my gloves off and toss those away. I'm going to do my hand hygiene. And I'm going to put on a new pair of gloves. At this point in the dressing change, if your doctor has ordered a wound culture, this is when you would get it. This would be the time. So I've put on a new pair of clean gloves, and I'm going to culture both of these wounds. Actually, I'm just going to culture this one for the sake of time. So I'm going to open my culture kit, making sure not to touch my Q-tip to anything. This would already have the patient's name and date of birth and all their medical identifiers on it. And I would open the tip and throw that to the side. So now I have the culture and the Q-tip. And you want to wipe everywhere that you see anything. You want to get a good sample of anything that's in this wound. If there were any drainage or anything, you would want to wipe through that. And you're going to twist as you go. So you're going to twist this Q-tip around and get all the edges of this wound without touching the outside of the wound. Then without touching the side of the wound culture, you're going to stick the Q-tip down in here and make sure it closes tight. And that's all of the wound culture. Okay, so I've removed all the dressing. I've done any kind of wound culture that's been ordered, and now comes the time to redress this wound. I've already put on my sterile gloves. I'm going to keep my hands above my waist. I'm not going to turn my back on my sterile fields, which I'll show you I already have set up, but I'm going to make sure not to touch anything that's not sterile with my sterile gloves on. So the first thing I want to show you is that before I put my sterile gloves on, I opened up all these containers. When I first started the video, I showed you what was in this container, so I opened and closed the paper back. I want you to just remember that you would never open something and then close it back, because then that kit would become unsterile. So I just assume that I have just opened all of the things on this table. The table itself is not the sterile field, nor is the dressing, that the bandage, the drape that is over the table is not sterile, but inside each of these containers is the sterile part. Okay, so first thing I'm going to do is take out anything in this kit that I don't need. So I'm going to take out the forceps, because I'm going to use those, and I'm going to toss the bag and the drape to the side. And I already have a set of 4x4s here that I'm going to use, so I'm going to toss that out too. And the only thing left in there that I might use is the ABD. I'll use that to cover. I have one here also if I need an extra. Okay, so assume that before this all started, when I opened this container, I went ahead and poured my saline into this container of 4x4s. And then with my sterile hands, I'm going to pick up one of these, and my hands are sterile so I can touch the dressing. I'm going to go ahead and open it up and kind of crunch it and squeeze out any excess saline that might be on there. Then I'm going to open this back up. And this usually works best with a bigger wound than what I have here, but I'm going to do the best I can with showing you how to pack it with this size of a gauze. So I can either use this forceps to help me pack it in there, but I think the best thing to use is a Q-tip. So I'm going to set my forceps down, and I'm going to grab my Q-tip. I'm going to take this Q-tip in this wet gauze, and I'm going to start packing it without touching the edges of the wound as much as possible. And I don't want to touch anything with my hands right now because I have on my sterile gloves, so I'm just going to move this down, pack it in as much as I can. Ideally, you would want to have just a strip of packing for this size wound because you would want to be able to pack it all inside the wound itself without touching the edges. But for this demonstration, we didn't have a long sterile piece of Xeroform gauze or anything, so we're going to use this. All right, so like I said, you wouldn't have this much packing in there, but it's all packed. You want to make sure you get into any corners and get the gauze down as deep as you can into that wound. All right, then I'm going to take my ABD and I'm going to cover it. Now this little wound right here I didn't dress, but you would just cover that with a 4x4 as well, or a 2x2. I'm going to lay my ABD over the top of that. I'm going to take my roll of gauze. I'll raise Mr. Bennett's leg, and I'm going to wrap the gauze around the bandage to hold it in place. Once I get the bandage wrapped the way I want it, I'm going to take the end and I'm going to cover that with a piece of tape to hold it in place. You cannot put your tape on the table pre-cut. You need to tear your tape as you need it. Don't ever stick a piece of tape on the side of the table. You will see that done, but don't do it. All right. Then I'm going to remove my sterile gloves. I'm going to do my hand hygiene. Just right here. And I'm going to take my pen and I'm going to put my initials, the date, and the time. And that way, the next person that checks it will know when the dressing was changed last. Then I'm going to go do my documentation, and then I'm done with wound care.